Hi, I'm Alice. I'm here to tell you what you should know about medications when you're in the hospital. Like many people in their 80s, I'm very active and independent. I look forward to every day thinking about what I want to do. However, from time to time, I've been in the hospital over the years. I assumed that because I was in the hospital, they would have correct information about my medications. I didn't think I needed to keep an eye on it. Let's go over what you should do to stay safe. First, when you go into the hospital, always take an updated list of medications you're taking at home. Your drugstore may be able to print this for you. You may also want to give a copy to a loved one. Also, take an allergy list that has any medications your doctor may have told you to never take. My doctor calls these never meds because I should never take them. You may not be allergic to the drug, but this may be the only way a medication bad for you can be flagged by hospital staff. Second, when you're in the hospital and a nurse brings you your meds in a little paper cup, make sure you know what the pills in the cup are for. If there are more or less than the number you take at home, find out what, why, and the side effects. If you have an IV, make sure you question any medications being put in the IV bag to know what they're for. You and your family should never be confused about your medications in the hospital. If they look different or aren't the same number you take at home, then ask questions and know what they are for before taking them. If there are new pills, be sure to talk about the side effects as well as what they're for. Third, before taking meds, make sure that they ask for your name and birth date. It's called the right patient check. Or that they check your wristband before giving you medications. A busy nurse might accidentally bring you a different patient's medication. Fourth, be alert for new symptoms that could be warning signs of medication problems, especially symptoms that you've never had before. In my case, I was given a drug without me knowing that caused symptoms I never had before. This caused symptoms like hallucinations, panic attacks, sudden loss of appetite or thirst, dizziness, falls, and infections while I was in the hospital. If this happens, you and your family need to think that new symptoms could be medication problems. It is important to ask questions. Talk to your doctor or someone in charge of your medications. Don't stop until someone proves to you that it is not a medication side effect. So remember, take charge. Bring medication and allergy lists to the hospital. Know what the pills in the cup are for. Be sure to check for the right patient check every time. New symptoms could be drug problems. When you get a bill in the mail, do you look at it carefully? Don't you think you should do the same with your medications? Your life may depend on you taking charge of your medications.
Thanks, Alice. It's important for anyone taking care of you in the hospital to know when you're feeling something that doesn't seem right for you. It could be a new medication problem. We rely on you to help us help you. This video is based on the Alice story, a real case derived from the tragic death of Alice Brennan, a vibrant 88-year-old woman who lost her life as a result of preventable medication errors and system failure. Designed by a volunteer group known as Elder Voices, the voice of Alice was provided by Nancy Turgeon, a dear friend of Alice. The information in this video would have saved Alice's life.